Staff at the Princess Margaret Hospital have expressed concern about their safety after a prisoner overpowered a police officer and shot him with his own gun on the weekend. In light of the past incident, Clint Watson tonight talks with the hospital's chief administrator about safety and security.
It's perhaps a good place to start following the weekend fiasco at the Princess Margaret Hospital. New protocols regarding security are coming out.
We want everyone to be safe, to feel safe, and we understand that our society has changed. As a result, our response as a hospital is going to have to change. And we're going to work together to see what that ends up looking like that works for us, so that we don't lose the personal touch while providing care to our patients.
Changes have been almost instant. There is now 24-hour police presence in the emergency room. Chief Hospital Administrator Coralie Adderley says meetings to strengthen communications between the police, private security, and PMH's security are ongoing.
When we designed the renovations to the emergency room, it was based on an expanded entry to allow for improved security checkpoint and to also have a place for the police to be and to also hold persons that may need to be held. So that is already in place. Now is to make sure that we have the presence and we properly operationalize what they do, what our private security firm does.
And with a changing society, the reality is the staff at PMH is confronted with outbursts from patients and relatives that sometimes get physical more often than they would like. But Adderley says staff has been trained to handle those aggressive persons while keeping their own calm.
But there are times when, even with that training, or the best of training, you need support. And that support sometimes is from law enforcement, or it may be from a security officer. And so it's ongoing. We have specific physicians who have become very good at training, and they will do ongoing training for all staff because it's not a one-off thing. So that's one of the ways we've been helping them to cope.
As to whether PMH is safe, the hospital administrator responded this way.
We continue to work on it. We continue to work on it. Our campus is very big. We have a lot of access points. It's compounded with the construction that's going on, that we have more people entering through certain entrances. So we have room for improvement, and we're working on it.
Adderley says what PMH is facing is not unique to an urban hospital, so they're evaluating what other international facilities have done to ensure everyone's safety. Adderley, however, says while service is a priority 24/7, they remain firm in this stance.
We will not support or tolerate verbal and physical abuse of any kind to our staff, to the patients, or to relatives. And we will work with the law enforcement to make sure that people understand that, because it's very difficult for professionals to provide care in an environment where they don't feel safe, where they're being verbally abused.
This weekend's incident has raised an even bigger question, and that is, should there be a separate facility to treat those who are accused of crimes versus those who are receiving regular medical care? It's an issue that now has to be discussed at an even higher level. Clint Watson, ZNS News.